Hello, this video is going to be on being efficient. You know, in dentistry, we have lots of procedures we have to do, and being able to do them as in short amount of time as possible without sacrificing quality is going to be the key to being the most productive you can be and also translate into a good patient experience. As we talk about this whole concept of efficiency, let's step outside of dentistry and talk about something that we're all probably familiar with, and that is what's the most efficient way to make toast with butter. You know, if you're going to try to make toast with butter, I think we all instinctually know that we have all these different things we're going to have to get in order to assemble a simple plate with some bread and some butter on it. What we would do is we would get the bread from the pantry, we'd get the bread out of the bag, load the slices into the toaster and start heating those pieces of bread. While it's toasting, we will then get the butter, the plate, and the knife in order to get this all put together so we can wind up with this plate with toasted bread on it with butter. So if we were trying to lay this out kind of in a sequence starting, you know, from one line to the other, start to finish, it would look something like this. We get the bread out of the pantry, we get the bread out of the bag, we load it into the toaster, and then we have to wait this whole time here in this orange area, waiting for the bread to get toasted. In the meantime, we would be doing this along a parallel track of time. While it's toasting, where we get the butter out, we're going to get the plate out, get the knife, get that all ready to go. These areas here are overlapping. That's what makes it efficient. We just kind of inherently know that. We would not get the butter, the plate, and the knife out first, and then go get the bread and the pan, you know, from the whole thing. We wouldn't try to stack like this. We wouldn't try to line them up like this. We'd stack them in order to get efficiency. So doing it this way, of course, would be wrong. I think we all know that. However, when we go to dentistry, I have noticed from some assistants that I've worked with over the years who've worked in other offices, they do things in a way that I think is quite inefficient. I'll give you an example here. Imagine we're going to do a crown prep. Okay, whenever we do a crown prep at the beginning of the appointment, we have to place topical gel, administer the shot, wait for the anesthetic to take effect, and then we're also going to need to get a shade, a preliminary impression for the temporary. In our office, we also take a PA and a preoperative photo. So I've had assistants come in and they do this thing where they do the shade, the photo, the impression, the PA, they do all that, then they place the topical and then wait for me, and then they come get me to give the injection. That is an inefficient way of doing it. It's better to stack it, just like you did with the bread and the butter and all that stuff, is that you place the topical, give the anesthetic, then while you're waiting, just like waiting on bread to get toasted, waiting on anesthetic to take effect, that's when you get these other things. So this isn't cutting corners. This isn't somehow doing things in a shoddy way. It's doing all the things you need to get done, but just sequencing them in a way that makes sense, at least makes it more efficient. What about this one? You could do this. We don't do this very often, but you could also change up a little bit of the sequence when it comes to making a temporary. Imagine you're going to do your crown, do a crown prep like you normally do, and then you, after you get the crown prep and you do the impression, after you look at the impression, you like it, then you move on to the next step of making the temporary. But you could kind of rearrange some of those pieces and do it this way. You could actually, after the crown has been prepped, you could get the temp started. And then once, it's been sitting on the top of the tooth, you take it to the side, you put it to the side, or take it out, you put it to the side. You don't trim it yet. You keep it over there. You then have to remove all the excess from the teeth. Make sure, it's very important, remove all of the excess. And then go ahead and take your impression. Most impressions take about 4, maybe 5 minutes to set. During that set time, that's when you could be doing this overlap thing. That's when you could now go back to your temporary, start trimming it. If you treat the internal of it with a sandblasting, alcohol, whatever you do to kind of get it ready, you get all that done. You could even go ahead and polish it if you have enough time. But while you're waiting for this impression to set, you could be doing these other things. Then, of course, once the impression looks good, you have your temporary, you put it in there, you check the occlusion and move forward. The main point being is that you could take 2 activities that need to happen. You need to wait for impression material to set, and you also need to trim the temp, treat the interior, polish. You have to do all those things. Find ways to stack things so that you can get the patient out of there sooner. They don't want to be in that chair any longer than you want them in the chair, so it's just best to find ways to make this work more efficiently. Here's another one. When a patient's coming to do a prophy and they're going to get a periodic exam. The hygienist will seat the patient. Maybe they take bite wings, maybe they don't, but they're going to go ahead and start their scaling, and then they're going to have to move to, polishing, flossing, cleaning the teeth, in general. That whole process takes a certain amount of time. At some point in that visit, the doctor is going to have to go in and do a periodic exam. So what happens? The hygienist calls for the doctor, and then they have to wait for the doctor. So here they are. They're waiting. Maybe it's a short wait, but maybe sometimes it's a long wait, waiting for the doctor. And then finally the doctor shows up and does the exam. So I've been in offices where the hygienist finishes the cleaning and then takes this green section here and moves it to the very end of the appointment. They call for the exam and then they wait. And who knows how long they're going to wait. They may wait 20 seconds. They may wait 4 minutes for that doctor to show up to do the exam. And then they still have to do the exam. Then afterwards, they have to clean and flip the room. Doing it this way, when it's stacked, the only downside is that the hygienist somewhere along here is going to be interrupted to have the doctor do the exam. But it's better to be interrupted and get it over with than to wait at the end for some amount of time. You just don't know how much longer that appointment is going to stretch waiting on the doctor. So doing it this way gives a chance for the patient to be let out of the room on time, as opposed to waiting at the end and, of course, then start running off a schedule or running behind schedule. Let's switch gears. Let's move to cavity preps. Let's imagine you're going to use 3 different burrs to do a cavity, your typical filling type prep procedure. You would, and to make it more efficient, you would take a case like this where you have, let's just say you're going to place these 4 fillings. You're going to prep them all. You would prep them all with burr number 1 first. Then you would prep them all with going on to your next sequence, burr number 2. And then you go on to burr number 3. You're going to hit each tooth with the burr before you switch it out. You do not want to go with burr number 1 and prep this and then switch it out and go to burr number 2 and do this and then go to burr number 3 and do this and then start the whole sequence all over again when you go to another quadrant of the mouth. You want to stick with 1 burr, get it all done, then move on to the next one. Continuing on with this example, imagine now you're going to have to fill these cavity preps. So everything's been prepped. Okay, that's what this means right here. You're now going to fill. Pick whichever side you want, left or right, not top or bottom, left or right, and fill. Once those guys have been filled, you're then going to check the occlusion. This one hasn't been filled yet. These have been filled, and the occlusion's been checked. Now, you go over to the other side. And then that's when you fill that one and then you check the occlusion. You would not want to go fill all of them at the same time. That would be very efficient, it sounds like, but until you come down to the next part, which is you have to check the occlusion. If you fill them all at the same time and then you start checking occlusion here and you get what you think is good over there, then you go to this side and you prep or you get that one down. Well, now maybe there's a high spot over here. You just keep bouncing back and forth. It's better to just pick left or right to get that occlusion dialed in first and then continue with the other side. A couple other things you could do to speed things up. You could have things put together. Oh, sorry, before I get too far ahead of myself. Imagine this sequence. Patient comes in to do a root canal. In the middle of the root canal, you're getting to the point where you're cleaning and shaping. You're finished that. Now you want to obturate, but the canal is still wet. It has either infection coming through, pus, or it has blood. Typically, what you do, you put calcium hydroxide in, you temporize it, send the patient away. They then come back for visit number 2, where then you finish the root canal, do your buildup, do your crown, take your impression, send them out the door with the temporary. They come back now for visit number 3, where you actually seat the crown. That is probably the most sequential way that most dentists do it. If the case is right, you could do it this way. Take those 3 visits and get it down to 2. How you can do that? Same situation, root canal cannot be finished. That's fine. You go ahead and put your calcium hydroxide inside the canal, then block the pulp chamber with Teflon. Place your buildup around it. Prep for the crown, take the impression, send the patient out the door with a temporary. They then come back a couple weeks later to get their crown placed. You then go back in through the top of that buildup. Again, it has to be the right case. You then finish the root canal. Fill in all the way up to the buildup. Test your crown, make sure everything fits right. Everything's good. You glue it in, finish. Now you've taken that 3-visit procedure and knocked it down to 2. You can also put together what I call grab-and-go bags. You think of everything you need for a buildup and crown. Mixing tips, impression tray, disposable matrix, all the typical things you would need for 90% of your crown preps that require a buildup. Get that all put into a Ziploc bag. Have a few of those ready to go in your operatories or wherever you store your stuff. So when a patient comes in an emergency and they want that crown right now, you don't have to spend time now trying to piece this all together. Your assistant's opening up drawers and trying to find the stuff to assemble it. It's already been pre-assembled and put together. Same thing you could do for endo. You could have a bag or a tub that has all the things you're going to need to do an endo procedure, all the different syringes and tips and files and sponges and rulers and all the things. Put it into a bag. Now, you may have to go buy a few extra things in order to do this, but buying those extra things is far cheaper than the time that you lose by being inefficient. Another thing you can do is add some kind of buffering agent like sodium bicarbonate to your anesthetic. That makes the anesthetic soak in or get its onset much faster. The idea here is that efficiency is equivalent to working smarter. When you're working smarter, of course, you're getting things done quicker. The patient, like I said earlier, is out of the chair sooner, and you're able to maybe even squeeze in some extra production for the day. I mean, if you're there working at the office, let's just make it happen. You can handle emergencies and work them into your schedule more efficiently, more smoothly without disrupting the rest of the schedule. And if you choose not to work, well, now you can go enjoy the rest of your day doing whatever else you want to do besides work. So efficiency is going to make a much more productive and situation for you. Also an office that flows better and a better patient experience. So look for ways that you can either rearrange the sequence, find ways to overlap, or pre-assemble things so you're ready to go on the fly when things come in the door. All right, that's it. I appreciate it. Thanks.